When pet owners are informed by their veterinarian that their pet is in pain and medication for that pain is prescribed, we want to make sure that pet owners are as informed as possible about all the potential consequences of treating and managing that pain. So there are some key questions that pet owners should ask the veterinarian. One is, "Doctor, what are the results of my pet's metabolic profile? What is the kidney function? What is the liver function? Is the bone marrow producing enough white blood cells and red blood cells? Are there any other tests that should be done or that I should be aware of?" Another question that should be asked, "What medications will I be giving? How often will I be giving these medications? Should I give them on a full stomach? Should I give them on an empty stomach? Should I give them at a very precise interval, like every 12 hours or every 8 hours? Or are they given once a day?" Additional questions include, "Doctor, what side effects should I anticipate I might see if my dog or my cat is going to have an adverse reaction to the medication you've prescribed? What should I watch for? Should I expect to see some vomiting, diarrhea, a lack of appetite? Is there any change in their mental attitude that I might expect?" Finally, pet owners want to make sure that they ask the veterinarian, "How long will my pet be on this medication? Is this going to be a lifetime medication? Will we change the dose as my pet ages? How often will we recheck the blood tests that were done prior to starting this medication?" I also encourage my clients to be very aware that pain management often can involve modalities of treatment other than drugs. In my pain management referral practice, we employ acupuncture, manual therapy, chiropractic techniques, and physical therapy techniques that are applied to pets much as they are applied to people. And these physiotherapy techniques include things like cold therapy and heat therapy, low-level laser therapy, and hydrotherapy using an underwater treadmill. Many of our pain patients no longer need the same strength of medication that we once believed we needed to manage their pain. Often, with the use of acupuncture, chiropractic, manipulative therapy, massage, therapeutic exercise, physiotherapy techniques, we can at the very least reduce the animal's reliance on medication, and sometimes they don't need medication at all. Sometimes I'm asked by pet owners, "What should I be concerned about in terms of pain and pain management if my animal has to have surgery? Either an operation to remove a tumor, to have a hysterectomy, for a male animal to be neutered, or to have a dental intervention where we know we have a bad tooth that needs to be extracted." I tell pet owners that I would expect them to ask the same sorts of questions that they would ask of their own physician if they had to have a similar procedure done. So don't be afraid to ask the veterinarian, "What are you going to do to help my dog or my cat be comfortable before, during, and after the surgical procedure that you have planned? Will there be medication that will come home with my pet so that I can prevent pain at home once the procedure's over?" You can never have too much information as a pet owner, and in particular, you can never have too much information about how to keep your pet pain-free as possible.